Welcome back to Medical Coding with Blue. Today's episode is all about preparing for your medical coding certification exam after multiple attempts. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so today I'm going to share some tips and some strategies about how to prepare yourself for your medical coding certification exam. Whether you are going to be sitting for the CCS, that is the gold standard of medical coding credentials, the CCA, the CCSP, or the CPC. These tips apply to all of these medical coding certification exams, okay? This episode was inspired by the following viewer. They said, "Hi Blue, I love your videos and tutorials. Thank you so much for your informative shows. I graduated from an AHIMA program starting from the ground up with college courses. I did 5 years of full-time employment while taking 16 hours of school per semester. I was heading towards the CCSP, the Certified Coding Specialist Physician-Based. That is the outpatient certification with AHIMA, in early 2022, but I failed the first attempt. I started to look at the CPC credentials after seeing a lot of coders on LinkedIn, and that seemed something that I was interested in. I wanted more of an outpatient setting as well. The CCSP is an outpatient credential, just saying. I started at 50 years old, and I'm now 57 years old. I have taken the CPC first at home in 2022 before starting a new job as a pharmacy technician. With moving and buying a house, I waited until mid-2023 and retook the exam at a friend's house, which was a huge mistake because there was too much noise and distraction. I waited and studied more. In May 2024, I took it at a testing center. Unfortunately, my highest grade has been a 66%. I felt like such a failure that I almost quit. I am back to studying again and watching your videos. Sorry this message is so long to you. I guess I need advice from you to keep going, and my third attempt for the CPC is in October of 2024 at a testing site. I feel huge anxiety when taking the exam that my mind stops. I will keep moving forward and keep looking at your YouTube site and books. I thank you for all that you do for us beginner coders to succeed." Okay. If you are in this type of situation where you're taking the exam and you're failing it, taking it, failing it, taking it, failing it, you're doing something wrong. You should not be taking it this many times. Twice, I can understand. But when we get into the 3 and 4 times, almost 5 times already, no. We need to stop and we need to regroup and look at what we're doing. This is not about, I have test anxiety and I get really nervous that my brain freezes up. No. What this is a lack of preparedness, not taking the studies seriously enough. Now, you may feel like you are taking your studies seriously, like, "Blue, I study at least an hour a night." Well, an hour a night and 5 nights is only 5 hours. When I recommend 20 hours per week of study. And before you complain, I have said this before, 3.5 hours per day is manageable throughout your day. It doesn't have to be in one sitting, and it should not be in one sitting. It should be 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes in the afternoon, and then 1 hour and 1 hour. That's 3.5 hours in one day. You do that in 5 days, that's 17.5 hours. And then you just have 2.5 hours on a Saturday or Sunday, okay? Or you can move the days around. It doesn't matter. The thing is getting the time in. When I hear from somebody like this that tells me that they failed the exam multiple times, I know they are not putting in enough time, because nobody who puts in 20 hours struggles this bad. You have to put in the time. You have to change what you're doing, because what you're doing, if you have been failing these exams multiple times, it's not going to work if you go from one association to another association. Now, we'll just say that, okay? It was a mistake to go from the CCSP and then, oh, we're going to jump to the CPC because everybody else is doing it. And I know that thing out there, oh, the CPC is easier. CPC is not easier. I have tutored many nurses who have failed the CPC. And when we got together and we looked at what they were doing, they were able to turn that around. I'm just saying. So with that said, it's not something that should be taken lightly, okay? The CPC does put up a fight. It is a very difficult exam. The AHIMA exams are very difficult as well. You get a little bit more time with the CPC because it's 2 minutes, 40 seconds per question. With the AHIMA medical coding certification exams, it's 2 minutes, 20 seconds roughly per question, okay? So that's the difference there. And you may think, Blue, that's not that much difference in time. Trust me, it is a big, huge difference in time. So that's the thing that we have to start looking at is, what are we doing that we need to change, okay? Because you need to take your old study plan and scrap it. Don't try to do the same things that you have been doing. Don't try to study the same ways that you have been studying, because clearly it is not helping you. You need to start all the way over again. Okay, so we're going to start with a clean slate. We're going to start off by making that schedule and getting those 20 hours in. Because trust me, when you have the time in and you've been practicing, it doesn't matter how long you've been in school. It does not matter all the things that you did to prepare or how prepared you think you are. This way of studying is going to help you to have a better chance of getting in there and okay, we know what we're doing here. We're going to go ahead and get this done. There's a better chance this way. So first of all, getting those 20 hours in and making that a priority. You have to make it a priority. This is not a negotiable where you can say, oh, well, I'll just do 5 hours this week and then next week I'll make it up. No, it needs to be consistent. And if you're wondering how long should you take to study, it really depends on you. But the soonest is however soon you feel ready. Some people, when they get done with their medical coding program, they're done and they're ready in a week to take their exam. And that's fine. If that's you, great, because then you've been doing what you're supposed to be doing. There's others that say, well, I need a month. Let me just have a month's worth of 20 hours per week. And then that way I can, get my studies in, and then I can be really prepared for the exam. That's fine too. That's a good time, 30 days from your graduation date, but no more than 90 days, okay, from your graduation date. But again, if you are failing again and again and again, you need to be taking 3 months between attempts, okay? Because that 3 months is going to help you to get all that time in that you need, right? Because 80 hours times 3, that's 240 hours that you have in of study time. Study time is listening to the guidelines or reading the coding guidelines. No, do not ask me. Please do not ask me about where to find how to listen to the guidelines, because I've explained it several times on the channel. And not only that, every time I do it, I get somebody that wants to get fresh and say, oh, the voice is so monotone. Guys, I don't have time for that. I don't have time for complaints. I'm here to help people. If you want to complain, I'm drawing the line. I am literally drawing the line. Please don't do that to me. I'm asking you, do not do that to me, because I will block you. I'm just saying. Now, with that said, we can get serious again. When you are listening to the guidelines or you're reading the coding guidelines, that's going to help you to understand what's going on, because I guarantee you a lot of you are also not doing that. Reading the coding guidelines is so fundamental to what we do. No, you do not have to memorize them, but you do have to understand like where it is, and you will get like that if you're actually reading the coding guidelines, okay? Some people read the entire guidelines every week in those 20 hours. They fit that time in. For some people, it takes them 2 weeks to complete the whole guidelines. That's okay too. That's okay too. It's just a matter of getting familiar with your books. And I've talked about that earlier this week when I did my tips video for how to become a better medical coding student, where I talked about getting comfortable with your books. And I see a lot of these people that they complain about failing the exam multiple times. And when they post pictures and stuff, they've got their books all tabbed up. This tells me, as somebody who does this and who tutors people, that when you are so reliant on tabs and extra things that you don't need to be dependent on, you're spending too much time looking at those tabs trying to get to where you need to go, Whereas if you are practicing with the book and working through the workbooks and working through those exercises, that's going to give you more practice with, okay, going exactly where you need to go. Because trust me, guys, the more time you get in with that book, the better off you'll be. Now, it's 3 manuals at least for these exams. So that's what you're going to be working with. So make sure that you are comfortable with all 3 of those. Again, if you're taking 90 days to prepare yourself after multiple attempts and you say, okay, Blue, I'm going to be serious about this and I'm going to do it your way. And you take those 3 months, that's 3 months you can focus on one book, another book, and another book, and then still incorporate them throughout. But at least looking through the entire ICD-10-CM book, ICD-10 PCS if that's on your exam, the CPT book or the Higgs-Picks book, looking through everything, that will help your brain orient where everything is at. Because a lot of people will tell me when they said, oh, Blue, I failed. Okay, well, what happened? Well, I forgot where everything was because I didn't really look in the book as much and I was only studying for 5 hours. So we know that we need to change what we're doing, right? Because if we're doing the same thing, we're going to get the same exact result. But if we want a different result, we need to change what we're doing. So this is going to require us to get more disciplined. It's going to require us to get more focused on what we're doing. Because this time for studying for your exam is a short window of time. Whether you're going to do, whether you just finished the program and you're going to do the 30 days, or whether you have failed and you're trying to be on your last attempt so that way you can pass this time, whether you're doing those 90 days, because 90 days is a good amount of time to be able to prepare yourself, because that's not giving yourself too much time to forget things. And it's also keeping everything fresh in that time, in those 3 months. So if you are working during this time, this is just the concentrated time of study. This is not going to be forever. Okay, guys? And again, if you're studying for 20 hours per week, this is going to make you even more disciplined. And not only that, you're going to be able to be so much more confident walking into that room because you have worked through the workbook several times. Even if you make it a goal of completing one book at a time, whether it's the CPC study guide, which I recommend for AHEMA exams as well, because we all use the same CPT code set. And I think that AAPC did a fantastic job with their CPC study guide. Or if you're working through the ICD-10-CM and ICD-10 PCS coding handbook with the answers by Nellie Leon Tizen. If you're working through that book is fantastic for breaking down diagnosis coding. So even if you don't have ICD-10 PCS on your exam, that's okay. You can skip those PCS questions because there's still plenty of scenario questions that cover diagnosis coding. And then there's plenty of workouts that cover just the diagnosis coding. So there's those things that you should be doing. You should be filling up notebooks every single week with your answers and writing them down and working through those workbooks and looking up those codes. And then that way you can kind of focus on, okay, well, I'm not doing so good in mother-baby coding. I'm not doing so good in ortho coding. So if you know that those 2 things are something that you suffer on when you're trying to get through these scenarios, read the guidelines, the chapter-specific guidelines for those specific topics that you know that you struggle with, okay? Just by reading those and concentrating on those, that way you can get more familiar and it's not going to be so scary when you see those questions. Because the more we can get confrontational with, we're going to confront this. We're going to confront this fear that we have of not doing well on the exam, or this fear that we have of not being able to pass. We are not going to let that be a barrier for us, okay? Right? We are not going to let that be a barrier. Because when we start thinking about like, oh my gosh, I'm going to fail. Like this person says, oh, well, you know, my brain just freezes. Your brain freezes because you're not putting in enough time. I know that. I don't know how much this person is putting in, but I guarantee it's probably not enough. Or if you're trying to do cramming sessions, that's too much. You know, I did that poll a couple of weeks ago now where I had asked about like, how many hours are you studying per week for medical coding? And a lot of people were checking off 5 hours or less, or they're not able to fit in the time. Again, we need to pass a certification exam, but we also need to be competent. And we do that by putting in the time and working through the workbooks, covering up those multiple choice questions and looking up the codes by ourselves. When you start doing that, when you start looking up codes by yourself, when you go back and you look at the answers and you uncover those answers and you see, okay, well, this was the answer. And then you see that, okay, now you know, okay, it was sequencing that I was off on, or I totally missed this code, or I was supposed to pick up a Z code, or it should have been an M code and I accidentally picked up an S code. Those are things that that's how you can start narrowing down what your problem is. And then if it's about HIPAA or any of those things are just a Google tap away. That's it. That is literally it. And it's not all of these things like y'all are making it out to be, where it's so incredibly hard. It's not. It's incredibly simple when you're putting in the time. It is incredibly simple when you are putting in the time. If something does not make sense to you, if mother-baby coding does not make sense to you, CPT coding does not make sense to you, and don't get all wound up about E&M, okay, guys? If you look at the domains of your exam, you will see that E&M is a very small portion of those tests, right? And so if you see that E&M is a very small portion of those tests, you need to be focused on, okay, well, I need to know the basics of it. I need to know enough of it, but I'm not going to stress myself out because there's so many other things that I need to focus on as well. Focusing on your speed, focusing on all of those things. Because I guarantee you working through those books for 20 hours per week, you're going to get fast. And you're going to get fast, and you'll see that speed start to pick up after like 2 weeks. You'll really start to see that speed pick up after 4 weeks if you are consistent with it. Right? So I'm just saying, right? Now, when you are studying, you need to study for 30 minutes minimum, 1 hour maximum. Okay? 30 minutes minimum, 1 hour maximum. Because if you are doing that way you can focus on taking a rest in between, your brain can relax, and you can focus on getting back to your studies. You can make sure that you stay hydrated, make sure that you eat foods that are good for you and that are going to give you energy, as far as like not, being so caffeinated and things like that. That's very important, guys. Getting out into the sun and having a few minutes, in the sun so you can get that energy from the sun. That's very important. I've talked about that again earlier in the week, but getting these messages, I swear people don't watch my latest shows, but that's what you guys need to know, is practicing. When y'all say, well, I don't understand, and then you can't tell me specifically what you don't understand. So then I know that you're not working with your workbooks, because if you were working with your workbooks and you're saying that you don't understand, you would be able to tell me exactly what it is that you do not understand. So if you're saying that you don't understand something, make sure you legitimately do not understand it and that you are asking about it. Find yourself a mentor. You can go on LinkedIn. You can ask the question on LinkedIn. Don't get into all this, oh, I'm a nervous test taker and I'm so scared and I blah, blah, blah. No, get right to the question. No one has time for all the fluffy stuff. That's the problem nowadays. People get so fixated on the way they feel, and they let their emotions drive them, and they let, their emotions and how they feel, and I just want to give up. You're going to give up on studying. You're going to give up every single time until you learn your lesson. I'm just saying. So like I said, when you're going through and you're doing all your practices and stuff like that, and you're giving yourself your breaks, and you're watching that clock, you're setting the timer to make sure that you're studying a minimum of 30 minutes, a maximum of 1 hour. And again, you can ask questions on LinkedIn. You can just post the question, whatever your question is, and then you'll have people popping up answering your question for you, okay? And saying, okay, yeah, there's this and there's that and there's this. You may have to hire a tutor. Sometimes that's necessary. And it's not for every single time, but maybe there's a list of questions that you have that you want to ask a seasoned professional, and that would be a good investment for you, because sometimes that's what it takes, is somebody to explain it. Sometimes it's not always the easiest thing to learn everything from the book, and sometimes it's nice to have that human connection to have somebody explain it. But that's just the other option. But focusing on, oh, I keep failing, and having that those words overplay in your head, that's not going to get you anywhere. You need to focus on this. This is going to be it. I'm going to pass this test. I am putting in the time. I am working on my speed. I am reading the coding guidelines. Reading the coding guidelines. I can't stress that enough. When I see basic questions sometimes on LinkedIn, sometimes people will post them, and I'll be like, that's the guidelines. That's in the guidelines. You would know that if you looked at the guidelines. But I don't answer. I don't answer some of those questions because, like I said, to me, that's something that I always talk about that on this channel. Always. The guidelines are so important, because that is literally the rules. You want to know how to code? You read the guidelines. Okay? And you want to look and see what these modifiers mean? There's a whole section in the CPT manual explaining what those modifiers mean and when they apply. The inside cover of the CPT manual also talks about the modifiers and things like that. I have a ton of videos on my channel where I talk about the books, and I actually open up the books and I show you guys the books. No, I'm not leaving the links because you guys can go through these videos. It's all about research too when you're becoming a medical coder, because research is a huge part of what we do in coding. Okay. And we do that because we need to find the answers. We need to find proof. We need to find backup. We need to find all of these things. And that's part of the learning process. But be patient with yourself, and also make sure that you hold yourself accountable. No one else can hold you accountable but you. And some people will try to utilize tutoring as a way of, having somebody else hold them accountable. No one can force you to do anything, guys. No one. No one can force you to do anything. You have to want it. No one is going to sit here and baby bird feed you the whole thing. This takes effort. It takes energy to learn. It takes getting some of that hard truth as well, and accepting the fact that, yes, maybe I haven't spent as much time as I should working through the workbooks or practicing or doing any of those things. And when people tell me, well, Blue, I want to have a life too. Again, this is just a short amount of time, and 20 hours in such small increments of time that's added up throughout your week, that's nothing compared to the time that you waste doing nothing, sitting around on TikTok, sitting around on Instagram, or whatever the heck it is y'all are into now, and all that wasted time. Please don't tell me that you want to have a life, but you don't want to have to do all the studies, because that's what this field requires you to do, is to study. And the way that I'm telling you balances it out, where yes, you can still work a full-time job, you can study 20 hours a week, and you can still have a life. But some people think that anything extra other than their 40-hour per week job is just too much. And if that's you, again, that's this field is going to require that. If this is what you want to do, then you will make the time for it. Okay? I'm just saying. And we need to stop all the excuses again, folks, because again, I'm starting to hear excuses again from people. Oh, this and oh, that, and oh, I'm just so anxious. No, you're not anxious. This is because you are not spending the time studying. Trust me, if you start spending the time to study, you will see the difference in the time. You will see the difference in the time. You will see the difference in your confidence level. If you're reading the coding guidelines, or you're listening to the coding guidelines. If you're writing out flashcards about HIPAA or whatever it is that you need to do that. Again, you're connecting mind and body. You can get digital flashcards. There is Quizlet. Quizlet is great, But again, I always encourage you guys, and you can use the flashcards that are in Quizlet, and you can write those out yourself. Because that will help you to retain that information. Anytime we can connect mind and body to an activity, we are going to remember it better. It's not about memorizing, but it is about connectedness in what we're doing and taking the time to study. And having the discipline and the willpower to say no to things that we want to do that are fun and that we're going to have to put aside for right now. Because it takes sacrifice to be able to get where you want to get to. And to be able to get into the lifestyle that you want to. Because it's not going to be handed to you. No one is going to get this easy. I'm just saying. So with that said, take my advice or don't take my advice, guys. I mean, I can only tell y'all so many times. I feel like I'm a broken record. I really do. But this is what y'all want to hear. And this is what I'm telling you guys. I'm not here to sugarcoat anything for you. I'm not. Because in the world that we live in, and in how people are so into their emotions and stuff, and not taking life into your consideration and being, like, hey, we've got to get this. Because you only get one rodeo. I tell y'all that all the time. You get one rodeo. That's it. And when it's done, it's done. And so many people tell me, oh, Blue, I should have done this. I should have done that. But then what are you waiting for? Oh, I'm too old. I'm in my 50s. You're still breathing, right? You still got your wits about you, right? It has nothing to do with your age. This field welcomes people from all ages and stages of life. It is on the coder. It is on the individual and how much they know and what they're bringing and how they're willing to learn from other people, critical think, be a problem solver, and work autonomously. Those are all things that we have to have in order to be strong coders. I'm just saying. You can do this. You have the discipline in you. Every single one of us has a discipline in us. But you have to do it. You just have to show up. You may not want to do this. You may not say, oh my gosh, this is so, I don't feel like doing this. Take a break, 5 minutes, 10 minutes, get reset, and come right back to it. I'm just saying. That's my advice anyway. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.